Well, millions of chickens at a commercial egg-laying operation in Colorado are set for culling after a new bird flu outbreak. The governor issued a disaster declaration after the virus was detected last week in birds at a Weld County farm. Almost 2 million chickens will be killed to try and stop the spread of the highly contagious avian influenza. The state has already culled more than 6 million commercial birds since May. The same strain of the virus has been circulating through dairy herds in the state too, but it is rarely fatal in cows. Still some alarm there, though, about it showing up in cows. Avian flu has traveled beyond Colorado, too, spreading to almost 140 dairy herds in 12 states and infecting 4 people that we know of so far this year. The FDA is now increasing its testing efforts, hoping to curb the spread. We want to bring in America Tonight medical contributor Dr. Omer Awan. Dr. Awan, thanks for being with us. This week, you wrote that increased testing is critical for this bird flu outbreak. Tell us why.
It's absolutely critical, Maritza, because honestly, if we don't test, we're literally walking blind and we have no idea how to contain and detect this virus. So, when we test for certain viruses and diseases, we can then identify them. We can give people the treatment that they need. And as you said, when you test, you can absolutely institute certain things like, quarantine zones. You can restrict the movement of birds and, different products like dairy products across states to help prevent and contain the virus. And even more important than that is that you can ultimately prevent the transmission of the disease. When we test, we're able to really isolate different strains, problematic strains of the virus, concerning strains that may lead to infection and possibly sustained human-to-human transmission. And that's really the cornerstone for how vaccines are created, by being able to understand the genetics and the composition of these problematic strains that can then cause infection. So, vaccines, as we know, has contributed to saving millions and millions of lives when we consider the COVID-19 pandemic. And if the bird flu were to ever become a pandemic, vaccines would do the same thing. So critical that we are able to test as much as possible.
Yeah, and speaking of COVID-19, I remember when the Omicron mutation happened, and a lab here in Missoula was testing and monitoring for that variant so we could gauge how fast it was taking over. So is this mass testing, that was with humans, by the way, who could talk about symptoms and what they were feeling. Is this mass testing the only way we're going to know if H5N1 has mutated into something that could be easily spread among humans?
It's a start, Maurice, and it's honestly the only way that we as scientists and public health officials are going to know whether it's a serious issue and whether there will be, sustained human-to-human transmission. Without testing, we're living in dark, right? We're not able to understand who's getting infected. We're not able to understand who to treat. We're not able to understand the biology of the virus, and we certainly aren't going to know who's at risk. And if we don't know who's at risk, then things can spiral out of control very fast. So testing really is the cornerstone for all public health initiatives, particularly if there is a virus that's circulating, and something like the bird flu, which is not very common right now in humans, but certainly has a high mortality rate, meaning that a lot of people who are getting infected, a lot of them are dying. That's not the case here in the United States, but overall globally, that is the case. So really important that we take testing as serious as possible.
And every time we talk about this, Dr. Awan, this is what comes to the top of my brain. How about testing people? Where does that fit into this? If you have symptoms, do doctors' offices even have the capability to test people for this?
So very critical that we test farmers, and not all hospitals have the capability. And a lot of times these nasal swabs have to be sent to, different laboratories that specialize in the testing of the bird flu. So it's a shame that we don't have more manpower and more facilities that are able to test for bird flu. But, farmers, if they can, should really get tested if possible. And I understand the hesitancy because, this is their livelihood. Farmers need the revenue to put food on the table for their families. So I totally understand that, they may be reluctant to get tested, but ultimately this is going to save lives. And this is ultimately going to also bolster the economy, because the more testing there is, the less the probability that an outbreak will last for a very long time. And then, this won't affect revenue as much in the long run. That's the key, right? So very important that farmers step up. If you have symptoms of fever, cold, sore throat, runny nose, watery eyes, itchy eyes, very important just to get tested and at least go to the emergency room and see a doctor so that you can get the treatment that you may need.
All right, great advice there. America Tonight medical contributor Dr. Omer Awan, thank you so much, and we'll be right back.